Okay, you're live.
Hey guys, it's Elizabeth and Brittany at Dr. Emer's. Our lovely patient today is struggling with some photoaging on her forehead, and then she's got a little bit of melasma on her cheeks. It's not too dark. How long have you had your melasma for, Brittany?
Probably for like a couple years.
And when do you think it started? What do you think triggered it?
Hormonal, also pregnancy.
Okay, yeah, a lot of women will develop melasma during pregnancy. It's sometimes melanocyte stimulating hormones will trigger a melanocyte activity, so there's an overproduction of pigmentation. Now, there's a direct correlation with melasma and being out in the sun. So if you have melasma, you definitely want to make the right lifestyle changes. Get chemical peels every couple of months, such as the Enlightened Peel that Brittany's going to get today. You can also complement this really well with some great lasers like Clear and Brilliant. And you always want to make sure that you're using pigment-suppressing skincare. But the most important thing for women and men with melasma is to avoid the sun and wear your SPF every single day. Right, Brittany? Do you do that?
Right, every day.
Okay, good. So you can see that she's got some melasma here. She has a little bit of pigmentation here. Photoaging. I see a little bit of photo damage on her forehead as well, so we want to make sure to target all of that. So right now I'm doing the prepping solution, which is medical grade acetone, and I'm using this so that the skin is dirt and oil free so that my peel is able to penetrate. So for those of you that are like, yes, I want to do a peel, but I don't want to jump into anything super aggressive like Cosmelan, this is a great step toward Cosmelan. It's also a great alternative for people that don't have very dark melasma like Brittany, or people that just want nice rejuvenation in their skin. Of course, it's also great for anyone that's oily or breakout prone. It's awesome for post-inflammatory hyperpigmentation. Yeah. Do we have any questions?
Not yet.
Okay, so I'm going to do my second pass now. I'm going to do this with a little bit of rough gauze. I'm going to be a little bit rough on her skin right now. Just want to make sure that I get it a little bit red. I want to cause a little bit of microcirculation there. You can see it's getting a little bit pink, a little bit red. All right. So this is my first step to prep the skin. And it's gonna look like Brittany's wearing pumpkin puree, and she's gonna leave it on her skin for 10 hours. So this is my peel here. It has active ingredients such as kojic acid, azelaic acid, hydroquinone, retinol, and high concentrations of salicylic acid. So this is gonna go on her skin. This is almost like a combination of pumpkin puree and caramel sauce is what it looks like. She's gonna leave this on for about 10 hours. Her skin's gonna feel fine while she has the peel on. It's when she goes to remove it that she's gonna feel a lot of heat and sensitivity. And that's gonna last for a couple of days. We're also gonna give her the right home care. So when she goes home, she's gonna be using a combination of retinoic acid combined with hydroquinone and different pigment suppressors to help brighten her skin, but also to help control her melasma. Remember, we're controlling the pigmentation, we're never getting rid of it. So you always have to do treatments to maintain it. It's not enough with melasma to just do one treatment and think that that's enough. You have to use the right skincare and you have to continuously do treatments. So this is the Enlightened Peel by Rev Skin. It's a great complementary treatment to Cosmelan. It's also great at maintaining Cosmelan results. We're gonna feather it down a little bit because we don't want a clear line of demarcation around her jawline, so we wanna feather it down. And she's gonna wear this for 10 hours. We wanna make sure that she's not working out tonight. She's not doing anything that's gonna generate heat in her body. She's not eating any spicy peppers, anything that would trigger heat. We definitely don't want her to do. So this is the Enlightened Peel, a combination of pigment suppressors and skin lighteners. Hydroquinone is the fastest working pigment suppressor that we work with, and that helps to minimize the pigmentation. It also helps to lighten and brighten the skin.
When do you use the Enlightened Peel versus using Cosmelan?
So that's a great question. So Cosmelan is always my go-to if someone has very stubborn dermal melasma, like it's very dark, they've had it for 20 years, 10, 15 years, and they've tried everything and nothing has seemed to work. Enlighten, as you saw with Brittany, she didn't have very dark pigmentation. So I think that with Enlighten, she's still going to get a very, very good result. She's going to have a downtime of about 7 to 10 days, which is a little bit more tolerable than with Cosmelan. Cosmelan is about 2 weeks of downtime, solid downtime. I also like to recommend Enlighten for anyone that has oily, breakout-prone skin because it has high concentrations of salicylic acid. That really does help with the breakouts and with any post-inflammatory pigment. So for those of you that have acne breakouts and you sometimes pick at them when you shouldn't, and sometimes they turn red, sometimes they turn brown, Enlighten is the perfect peel for that. So I think we're done. Do we have any other questions?
Val asks, does this take care of extra pigmentation like freckles or birthmarks?
Yes, it can. Absolutely. Freckles are so cute. But yeah, if they bother you, we can definitely treat it with Enlighten. Thank you guys for watching. Bye.